One of the most common questions I get asked by patients in a new visit is, what does my cognitive score mean, and what's likely to happen to me over the future? So what we like to do is to map out a graph that looks at somebody's Montreal Cognitive Assessment Score, often called the MoCA. What we see with the MoCA is that if you have mild cognitive impairment, you see a curve that goes a little bit like this, where in general, when somebody has documented mild cognitive impairment, the drop in the MoCA can be between 1 to 3 points a year is a standard drop. Usually there's less of a drop in the first couple of years, and then that can accelerate over time. So that's the natural history of mild cognitive impairment. What we can see with precision medicine, our goals is first, if somebody's having a decline, is we want to stop the decline. So stopping the decline in a progressive condition has to be viewed as a success. With the research, we've seen a signal that we can get improvement on the Montreal Cognitive Assessment Score. The randomized control trial is going to really be the first randomized trial of precision medicine in this area. With the trial, the key concept around the trial is that this is a precision medicine approach. What all the interventions have in common is that we're looking for a set of root causes. We're looking at those root causes and looking to how we can address those root causes by a broad toolkit of interventions.
The study was designed to section people off into two groups, one being Group A and one being Group B. Group A would get the treatment or the intervention now, immediately as they started their treatment with us. The Group B patients would have to wait a course of 9 months, not make any changes or implement any new protocols in order to act as a control for the study. So my role in the study, I was the essential backbone of making sure everything worked as smooth as possible in accordance to the protocol. My role was to help onboard the patients, get them ready for the actual protocol and all of the testing. As a research coordinator, you are the conductor of all of the events, so you're making sure that each patient gets to where they need to be and they fit whatever step they are into the protocol. That means scheduling them for their next treatment, for their lab work, what have you, as well as making sure that that data gets inputted into the system and uploaded for the entire study to see and utilize for the later research.
I think that cognitive decline, as well as most chronic diseases, are multifactorial, which means there's not just one cause of the condition. And so if you have a multiple root cause condition, it would appear pretty logical that the solution for it should be multi-modal interventions. You have multiple interventions. So therefore, the process of precision medicine is trying to look at the individual patient and say, what is going wrong? What are the options that we have to fix it? And what's the right solution for you? What was very clear in the study is that we were able to optimize the amount of education that patients got. And so the protocol was very heavily front-loaded to the high dose of coaching and structure to help patients really learn all of the different parts of the changes in food and exercise and sleep and brain exercises that were necessary. In the first 2 months, patients usually got at least weekly interactions with the team.
In the Evanthea study, my role was as the dietitian that would help people with the diet for brain health. And also I was the coach, the brain health coach. I wore 2 hats. So I would also help people achieve all of the goals that they had with their treatment plan. In terms of being a brain health coach, What I try to help people do is integrate lifestyle changes that support brain health, whether it's diet, exercise, detox practices like sauna, supplement regimens, which can be a little bit complicated in the beginning until we get everything stable. A lot of my patients, they still worked. They were business owners. I even had one that still was raising a teenager. And it's hard sometimes to integrate these practices into day-to-day life when we all have such busy lifestyles. So it's my job to work with the person, meet them where they're at, and try to fit these things into their life, along with all of the other important things like family and work, or volunteer work, or whatever they have to do. Just the variability in people. Like one patient, had a harder time tolerating a supplement compared to another one who had no issues. A lot of our patients, I was seeing a huge difference. After 6 or 7 months on the program, I had people who would forget what they were saying to me mid-sentence. And then by the end of the study, they were talking with much more fluidity.
One of the biggest moments that I think really drove home the message and the importance of the study was not only seeing all of our patients be able to fly the nest and be able to implement what we've taught them in their everyday lives, but was seeing their personal wins and their personal journeys. I had one patient who came to us through the study who she was really troubled by her own issues with aphasia, not being able to get her words out effectively. By the end of the study, she was able to regain her singing voice and be able to sing an entire song without feeling like she didn't have the confidence or the ability to get the words out. And that meant the world to me. It brought tears to my eyes when she showed me her video of her singing at a friend's funeral. A lot of our patients were, your typical day-to-day working families. They had 9-to-5 jobs. They had partners that supported them. So being able to take time out of their day and really work on their health was critical to not only pushing their drive to success, but also to pushing our desire to change and to change the way healthcare sees mild cognitive impairment out into today's society.
The value of the team in doing this was a clear lesson that we learned. What we see for the practice is trying to get some of the changes that the execution that we got in the study, we want to make that as readily available to patients as possible.
One of the takeaways that I think the study taught me was to take pride in patients' personal wins, whether they be big or small. Just by following the protocol is great. It's not enough unless you can really see yourself winning from the small steps that you've taken.